My name is Jana Anderson, and on behalf of my Athena SWAN group and the Athena SWAN initiative in our institute, I put together this presentation which aims to raise awareness of issues that our staff with carer responsibilities may face. I would like to share with you the key messages from a social care survey conducted at the end of 2020 by the Carers Trust with over 2,000 unpaid carers around the country. It highlights some of the concerning issues that people with caring responsibilities face all around the country, and issues that have been made far worse due to the current COVID-19 pandemic. We hope that if you do not have caring responsibilities at the moment, but you would like to know more on how to support your colleagues that have, you find the presentation informative. And if you do have caring responsibilities and are affected with similar issues, please be aware that there is some help available to you. The University of Glasgow now has a definition who qualifies as a staff carer, and it has a policy in place to support such staff. And in the Institute of Health and Wellbeing, as part of our work on how to support our staff carers better, we would like to establish a supportive peer network. So if you are or think you might have caring responsibilities, do get in touch with IHW admin to become part of our Care Buddy scheme, which is an informal or will be informal supportive peer network. And we will continue to strive to increase our understanding on how we can support you and other colleagues with caring responsibilities, both formally and informally, to continue and create an understanding and empathic workplace culture. Now let's move on to the summary, the key messages, and also some direct quotes that were published as a result of the survey. In September 2020, Carers Trust asked unpaid carers what needs to be in place to support them in their caring role and how social care should help them more effectively. The results of the survey were published in a report in November 2020 and called A Few Hours a Week to Call My Own. The survey found that only 12% of unpaid carers agree they get enough support from the social care system. The survey painted a highly concerning pictures that the unpaid carers face with loneliness, stress, financial concerns, poverty, and impossible choices and constant juggling. A few quotes demonstrate this. One carer said, money, I currently work, but I'm having to give up work because I can't afford to care and work anymore. It's ruining my health. This will leave our finances in a mess, but I don't have a choice. Next one worried about deterioration of my dad and balancing that with my part-time job and university course. Another carer said, it's having to give up my job and not having enough money to support us as a young family with children. Working is taking its toll on us all, but quitting would mean we are financially worse off and we need that extra income. Another carer worried that my mental health breaking completely, and what would happen to my daughter if it did. Or another said, another lockdown and no access to COVID-safe support. I'm on my own with this. Another said that we are left behind. We haven't been hardly anywhere since March. People have been living their own lives, which is fine, but we aren't living ours. We are existing only as the risks to us are too great. So we feel left behind. We can't see this changing. Another carer said, my health isn't that good, so I worry about my child and where to go for help and information. And a last quote, everything, death, being able to cope, the crushing loneliness and poverty. According to the survey, almost 2/3 of unpaid carers are now spending 50 hours or more per week caring for a family relative. This suggests that in just 9 years, the proportion of unpaid carers providing 50 hours of care or more per week has almost tripled since the 2011 census. The coronavirus pandemic has made things worse. What was already a dire situation for unpaid carers, many of whom were at breaking point even before the pandemic struck. The report found that 1 in 6 carers reported the lockdown and closure of local services have forced them into caring for an additional 40 hours or more per week. And 54% of carers have given up or reduced paid work because of caring responsibilities. When asked what 3 things would make the most difference to their lives, the unpaid carers were clear that they need more services and support for the person or people they care for, better mental health and emotional well-being, and enough money to cover their day-to-day living costs. And with 4th being better social life, more time to see their friends and do the things they enjoy. As shown on the previous chart, the most common choice that would make the most difference was to have more services and support for the person or people they care for. And 34% of carers selected this as most important, and 64% in their top 3. The second most common choice that would make the most difference was better mental health and emotional well-being, with 21% of carers selecting this as the most important for them, and 58% putting this in their top 3. The third most common choice was having enough money to cover their day-to-day living costs, with 15% selecting this as the most important, and 40% in their top 3. And lastly, as mentioned before, the 4th most common choice that would make the most difference was a better social life and more time to see their friends and things that they enjoy, with 7% selecting this as the most important and 39% putting this in their top 3 choices. When the most common responses were organized into a visual chart, again 3 emerged as the most important for unpaid carers. It was the money, the finances and the costs connected to being unpaid carer. It was a better recognition of unpaid carers and a better practical support and more support from the social care system. The report then selected direct quotes from the carers that demonstrated that they feel they do not get enough support. One of the carers said, "As a full-time student carer, I am unable to apply for carer's allowance, which often is a criteria requirement to access further support." Or next one said, "The carer's role is hugely undervalued and underpaid for the jobs that are done. And the small amount of £67 goes nowhere, especially in this climate. A carer's role does not stop at 5 p.m. The jobs to do are always there, and if broken down, the £67 doesn't even cover the national minimum wage for an adult. If a carer was to be paid for 30 hours at £8 per hour, that would come to £240, significantly higher than £67. The financial worries only add to the stressful process of caring for someone." Next carer said, "I'm caring for my wife with no practical help since COVID-19 from anyone and no respite. This is a 24/7 caring role." Next carer said, "Coronavirus rules exclude a section of the support workers, so it literally means we are housebound." Another carer said, "There is no respite care relief in my borough, and I have personal responsibility for the person with care needs, 24 hours a day, 7 days a week." Another carer said, "There is nothing for me. Services seem to operate on a weekday. I would have to use my annual leave. I don't feel like anyone gets what it's like to support someone with mental health issues. People just tell me to take care or look after myself." The next carer said, "I don't receive any support apart from receiving carer's allowance. Nobody would even be aware that I was a carer unless I told them. I'd like it if there was a recognised scheme that acknowledges the role of an unpaid carer, similar to the way NHS and emergency services have." And lastly, one carer said, "Since COVID-19 pandemic, I didn't get support at all." To finish this presentation, I wanted to say that the report highlights that unpaid carers are pleased and proud to support the person or people they care for. In most cases, they care because they want to and because they love the person they care for. All they ask for in return is the support they need to be able to care without the lasting impact on their physical health and mental health and finances. And we are all faced with serious challenges during the pandemic. However, social care funding, reform and better support for unpaid carers predates the pandemic and must be urgently prioritized by government. So thank you for your attention and for Carers Trust for sharing the findings. Please do get in touch with IHW admin if you'd like to be part of the IHW Carer Buddy scheme, or with anything you would like to share, highlight, or suggest that our institute can do better to support our staff with caring responsibilities. And please visit the following link for information on the University of Glasgow's definition of a carer, and to find the support available, such as the availability of up to 5 days of paid carers leave, which is on top of unpaid leave. Thank you.